Medicare estimates that the average Part D plan member with diabetes can save around $446 a year on insulin with the new Senior Savings Model Part D plans. That's a savings of around 66% and therefore a pretty big deal for more than 3 million Medicare beneficiaries out there who use insulin. Hi, I'm Danielle Roberts, and in this video, I'll explain how these new insulin plans work to provide stable copays for insulin throughout the whole year and what you can do to get one. The Part D Senior Savings Model allows participating drug plans to offer their members a set of formulary insulins at a maximum copay of $35 for a 1-month supply. Insurance companies who participate have agreed to provide these insulins at $35 throughout the whole year. This means that even when you are in the deductible period or the coverage gap, you will pay no more than $35 for the covered insulins on the plan's formulary. That's pretty amazing, right? Insulin costs on these new plans will be exactly the same no matter the coverage phase, making it easier for members with diabetes to budget for their healthcare expenses. It's the biggest and best change that we have seen for Medicare drug plans in quite a while. The Senior Savings Model is an opt-in program for insurance companies. They do not have to participate. However, CMS announced in May that over 1,750 standalone Part D plans and Medicare Advantage prescription drug plans had applied to offer low-cost insulin under the new model. And that's great because it means most Medicare beneficiaries will be able to find a plan offering the discounted insulins in their residential area. There are a few things to keep in mind, however, before you shop for plans. The Senior Savings Model is only available with enhanced Part D drug plans. Basic benefit plans aren't allowed to offer the new insulin copayment, so you may find that premiums on some of these plans are slightly higher than those on the basic plans. Also, insurers aren't required to include every type of insulin in their drug formularies. They could choose to cover an insulin pen from one manufacturer, but not from another, for example. However, the participating plans must cover at least one pen dosage form and one vial dosage form for each type of insulin, short-acting, intermediate-acting, long-acting, rapid-acting, in their formulary. Lastly, plans are allowed to set their insulin copayments below $35, but if they do, they must apply the same lower copayment to all 3 phases of coverage. So how can you find a plan with these capped insulin expenses? Go to mymedicare.gov and register for an account there if you haven't already. Enter your listed medications and preferred pharmacies into the Plan Finder tool. When you ask the tool to search for plans, a box pops up asking if you want to filter to see just the plans offering the $35 insulins. Click on that and you'll see a list of participating plans. Now, if that box doesn't pop up, you can also view the Part D drug plans by filtering them by insulin savings. If you go with the default sorting method, the plans that offer you the lowest overall annual out-of-pocket costs will always appear at the top of the list. And if you find one you like, you can hit the Enroll button and apply for it right through your mymedicare.gov portal. If you'd like to hear more about how Medicare Part D works, check out this video here. Thanks for watching.